Hello, good evening, everyone, and welcome to the first for this year open evening. A very warm welcome to Herts Essex. My name is Dr. Praveena Pai. I'm a consultant gynecologist and a fertility specialist in Herts Essex Clinic. And today, in this open evening with me, I have my senior nurse colleague, Jackie McAdam, who will be taking questions alongside. So if you have questions which arise in your minds, please keep posting them in the chat box. And I also have Mana Maths, our marketing chief, who plays a big role in organizing these open evenings. So again, a warm welcome to all of you, and let's get started. Are you able to see my presentation? So I am just going to start sharing my presentation. Do bear with me. Okay. Good. So what's on the agenda today? So there's a presentation which will take you through all the bits and bobs that our clinic offers. There is a question and answer session, as I said, which is happening alongside. Please do stay with us till the end. We would love to have your feedback because that plays a very important role in improving these presentations. And last but not the least, we do have an exciting discount offer for you. So that's in the end. I would also put up a clinic video, so it's like a virtual tour of the clinic, which is also available on the website should it not play through this presentation. But yeah, it's always nice to have a little look into what the clinic appears like and what it has to offer. So that's me, that's Jackie, Mana. So a little bit about the history. We were founded in 1989, so we've got more than 36 years of experience creating babies. We've got more than 8,000 lovely babies created. All procedures are performed under one roof, and what you'll find is a state-of-the-art purpose-built clinic. The services provided by us include couple fertility assessments, single female or male assessments. We offer gynecological screening. We offer treatments which include IUI, IVF cycles, fertility preservation such as egg freezing, sperm freezing, surrogacy. A lot of the work obviously surrounds IVF, ICSI, PICSI. We also offer additional treatments like pre-implantation genetic testing of embryos. So you might have heard terminologies like PGTA, PGTM, PGTSR. So we do offer those services as well. And we offer standalone pregnancy scans if somebody is conceived naturally or maybe you've conceived via treatment elsewhere. So the fertility assessments, essentially are of three types. We've got couple fertility assessments, which consist of 2 visits. We've got female fertility assessment, again, consisting of 2 visits. A male fertility assessment usually involves the male coming and dropping off the semen sample, followed by a telephone call with the embryologist to discuss results. So essentially, it's 1 visit. What do we do in a couple fertility or a female fertility? So one of the key things we do is for the female is to offer a very detailed 3D ultrasound scan, which allows us to have a look at the anatomy. We alongside do something known as saline infusion sonogram. So as you can see here, the introduction of saline into the cavity brings into the polyps or fibroids get highlighted really well. So that's something we offer to all of females coming in for treatment or just to assess their fertility prospects. We can also combine it with a tube test known as high COSY, whereby in the same sitting, we are able to pass a dye and see if it is spilling nicely through one or both tubes. So as you can see, there is a very fine catheter going in, saline goes in here, and once the saline infusion sonogram is over through the same catheter, we are able to pass some dye and look at the fallopian tubes. Before we commence any sort of treatment, whether somebody's trying, to conceive naturally or through less invasive procedures like ovulation induction, what's important is to try and get you into the fittest versions of yourself. So we lay a lot of emphasis because a healthy body, mind, and lifestyle can go a long way in helping you conceive. And as a part of this, we've got our nutritionist and dietitian, Alex, who works closely along with us. She's happy to see individuals and couples. She does virtual one-to-one sessions should you need these. She also runs nutritional workshops. So if you are interested in any of these, please visit our website and you'll get more information regarding the same. So what does the treatment pathway look like? So it begins with fertility consent. So we will send you login details, and on the fertility consents platform, we've got all the consents uploaded, which there are modules which you can look at, so you get an advanced sort of understanding about what to expect. There are forms that you should complete online. Any relevant investigations you've done elsewhere can also be attached. From there comes the next appointment, which is called a pre-assessment appointment. So it's an in-person appointment with a nurse. The couple, let's say, comes in, the nurse will do some blood tests, particularly AMH, which stands for anti-Mullerian hormone, which is to look at your ovarian reserve. We also look at the thyroid gland because that plays an important role in reproduction, and that is for the egg provider. We take the height, weight, and BMI for both partners. Just a word about the BMI is that for us to be able to start an IVF treatment, so that we, because it involves giving you sedation for egg collection, we do need that BMI to be below 34 before an IVF treatment can be commenced. For the male partner, he comes in and drops off a semen sample. Once the pre-assessment is over, we then book a consultation with one of the consultants. The consultations usually are done via Microsoft Teams, so you'll get an invitation sent to you either the previous evening or on the day of the consultation. If somebody desires a face-to-face, yes, we can facilitate that as well. What happens in this consultation, usually it's an hour-long consultation in which the consultant would have had a look at all your fertility consents, your uploaded investigations done elsewhere, the semen analysis results, the AMH thyroid results, and then he or she will then sit down with you and come up with a personalized treatment plan. So going forward, before we can commence treatment, couple of things that are logistics that we need to sort out. One of the things we have to do is screening bloods for both partners. And another one is another appointment called TIA, whereby you will sit with one of my nurse colleagues, and she will make sure that we've got all the appropriate consents in place. So let's talk about the screening bloods. So screening, the HFEA, which is a regulatory body which governs all the clinics in the UK, has made it mandatory that we do these blood tests, which include HIV, hepatitis B, Hep C, chlamydia, and gonorrhea for all individuals having treatment in any of the HFEA guaranteed clinics. The additional screening, which is done for the egg or the uterus provider, is the AMH, as I already mentioned. We also look at her rubella status, a full blood count, and the hemoglobin electrophoresis to make sure that there is no hemoglobinopathy like sickle, thalassemia, etc. Now, these results should be up to date, as in what we've been asked to do is that once these bloods are done, the egg collection should happen within 3 months. Otherwise, these bloods will lapse. And consequently, we try and do these screening bloods as close to the start of treatment as possible. They must be done either in our clinic, or if you do them elsewhere, just make sure they're in a UK accredited laboratory. So moving on with the treatment. So we've got a range of treatments that are available, and I'm going to start with one of the simplest ones called intrauterine insemination. So this is a procedure wherein the healthiest available sperms are introduced directly into the womb. IUI is used to aid pregnancy in heterosexual couples who have issues having penetrative intercourse. So it could be because of psychosexual problems, it could be because of vaginismus in the female, erectile dysfunction, or severe premature ejaculation in the male partner. It's also a good option for people using their own eggs and uterus with donor sperm. So it could be a same-sex female couple, for example. Let's now talk about IVF, which is the bulk of our work, if you like. So IVF treatment pathway starts with, so I'll just give you a little overview. So IVF essentially involves stimulating the ovaries by giving the woman hormonal injections on a daily basis for about 10 to 12 days, at the end of which we do a small surgical procedure and get the eggs out. So this procedure is known as egg collection. Sperms, which are provided on the day of the egg collection, are now put together with the eggs, a process known as insemination in our laboratory. Okay, and then the idea is to create embryos, do an embryo transfer, and then 2 weeks from there, we have the urine pregnancy test or a blood test to look at the pregnancy hormone. So that's the kind of overview for an IVF treatment cycle. So essentially, it starts with an ultrasound scan. We start the treatment with an ultrasound scan, which is a baseline scan, which is done on day 1, 2, or 3 of the cycle. This is the appointment in which we commence the hormonal injections. And as I said, they will continue for roughly 2 weeks. What to expect now, most of the women will tolerate these injections really well. These are very fine injections done in a subcutaneous fashion. The side effects that might be expected are headaches, mood swings, breast tenderness, bloating, and very rarely, particularly in women who've got polycystic ovarian syndrome, there is something known as ovarian hyperstimulation that we are aware of, and we take every possible precaution to try and avoid that. So, as I said, the baseline scan happens on day 1, 2, or 3, and then we bring you in for the second scan. Now, second scan is usually happening on day 5 or day 6. This is the scan where you would like to see really beautifully growing follicles. Now, follicles are structures within which the eggs are getting nurtured. So you'll see follicles like this. What we also do on the second scan is to start another injection in the morning, and this is known as an antagonist, and this whole protocol that we follow is called a shot protocol or an antagonist protocol. So the idea is to get those follicles, growing, but we don't want you to ovulate prematurely, and consequently an antagonist is started at this stage. We also monitor the endometrial lining. So it's the womb lining, because that's where the embryo is going to go in and implant, and the pregnancy journey commences. Each scan will be followed by a consultation with the nurse. So if you've got any queries, any confusion about injections, etc., you have an opportunity to discuss these with her. This brings us to the last scan. So usually it's the scan 3, in which you would like to see a beautiful lining. As you can see, a nice triple line endometrium getting ready to receive an embryo. So the final scan will determine the date and time of the egg collection. This is when we give we give you instruction on how and when to take a trigger injection. The trigger is usually in the form of HCG, although we've got alternatives. Detailed verbal and written instructions will be given about the egg collection procedure. So what happens on the day of egg collection? The couple is, let's say, invited inside. We take you to the recovery bay. Baseline observations are recorded. The male partner provides a semen sample. The woman gets a chance to meet the anaesthetist. We've got a good bunch of anesthetists working with us. She's then taken inside the operation theatre. She's given what we call as a deep sedation, so that she's unaware during the procedure. One of the consultants will then do a transvaginal egg collection. Takes about 20-30 minutes. Once the procedure is finished, she's wheeled back into the recovery, and once she's feeling well, she's come out of the anesthetic effect. She's had a nice cup of tea. She's been to pass urine. The consultant will come and visit her and tell her what was the initial egg number, and then they are discharged to go home. So it's a day case procedure, and you're in the clinic for roughly 2 or 3 hours. So after that, the focus moves to the laboratory. So what happens in the embryo lab? So day 0, so we've got certain landmarks that we'll keep mentioning. So day 0 is the day where egg collection is performed. Day 1 is the day where we want to see how many of these eggs which are left together with the sperms have fertilized, okay? And that is the day you will get a call to tell you about the FERT check result. Day 2, day 3, day 4 are quiet days. So we leave once we've got the fertilized eggs, we put them usually in an undisturbed culture. So we don't go and keep looking or disturbing these embryos. So the next relevant landmark for us would be day 5, which is when we would expect a beautiful expanded blastocyst. And that's usually the day we bring the lady or the couple in for an embryo transfer. So what happens on day 0? So there are a few things that can happen on day 0. As I said, we've collected the eggs. Now, someone might say, look, I'm not ready for an IVF cycle. I just want to do something known as egg freezing. So this is a method of fertility preservation. So egg freezing has been around for a few years. It's a reproductive technique to preserve fertility. Earlier, we could store these eggs for 10 years, but now we are allowed to store them up to 55 years. The quality of eggs, or sperms for that matter, are better the younger you are. So we've got a whole page dedicated. We actually ran a campaign about My Eggs, My Future, and we talked about how egg preservation is a sort of liberating and empowering method for women who probably are not contemplating starting a pregnancy journey yet. Egg freezing might be used by a lot of women, maybe because of social reasons. It could be because of history of early menopause in the family. It could be somebody who's been suddenly diagnosed with cancer and she's aware that, because of cancer treatment, her eggs are going to deteriorate and she might want to freeze those eggs because of that reason. Or it could be pre-surgery. These days, you must be hearing a lot about endometriosis, and sometimes endometriosis surgeries can have a detrimental effect on our ovaries. And we often get women sent across to have fertility preservation before complicated pelvic surgeries. Everybody is offered counseling before she can undertake egg freezing. So that's one of the key things performed on day 0. If a couple has decided to go ahead with a full IVF cycle, then one of the methods of getting the eggs and the sperms together is known as in vitro fertilization. In vitro means outside the body. IVF is something we resort to if we've got normal semen parameters and there is no history of intracytoplasmic sperm injection in the past, something known as ICSI. All right, so that's IVF. Also happening on day 0 is ICSI. So ICSI stands for intracytoplasmic sperm injection. Now, instead of putting just as eggs and sperms together in a petri dish and allowing a bit of natural selection, which is what an IVF entails, ICSI is a procedure whereby the embryologist takes a little bit of control. They want to see which is the best, most motile sperm, and each mature egg is injected with a sperm. And I'll show you a little video about it. When do we think ICSI is better? So if there are low semen parameters, it could be low count motility, more abnormal sperms. It could be a case of no sperms in the ejaculate, a condition known as azoospermia. It could be somebody who's got lots of antibodies causing clumping of the sperms, which means, we need to segregate, lift, and inject a sperm. Or it could be somebody who's come to us with a previous IVF fertilization failure due to an IVF cycle in the past. In those cases, ICSI is the preferred treatment. So let's try and have a look at this video, and I hope it plays, and I hope you can see this. There we go. So as you can see, we've got lots of sperms in the background. We've got an ICSI needle on the ready. And what we are doing is the embryologist is having a good look and trying to delineate a really good looking motile sperm. Once we've seen the one we like and we think is suitable for treatment, we are going to just immobilize it, can you see, by attacking its tail. Looks a bit traumatic, but that's the only way we can get this motile sperm into the needle. Once that's done, we've got this holding pipette, and you can see the beautiful egg which is being held. This injecting needle now comes, it penetrates the zona, brings the sperm close, okay? It's a really, really fine specialized technique. We then penetrate the outer covering called the ulema, go right inside the egg, aspirate a little bit, and then inject the sperm inside the egg. As I said, it's intracytoplasmic sperm injection. That's done, needle out, and the egg is now released from the holding pipette. So that's ICSI. And sometimes if we find that the maturity of the sperms is not adequate, we do something known as ICSI, which is physiological ICSI. So we will try and do a special test, make sure we've selected not only the morphologically normal, most motile, but the most mature sperm, and that's ICSI. And that's another technique, or rather another treatment that we do offer. So that's day 0, or all the steps that are carried out on day 0. What then happens on day 1? When we go and have a look, what we would like to see is a nice normally fertilized egg with 2 pronuclei. And once we've seen this, normally fertilized eggs are then moved into the embryo culture. And you will get a call to say how many of the eggs have now fertilized and are now going to go into that undisturbed blastocyst culture. What happens to these embryos as we leave them in the culture? They will divide, they will develop into a 4-cell embryo. On day 3, you would expect to see a nice 7-cell embryo. So these are called cleavage stage embryos. And eventually comes day 5, which is when we bring couples or the woman in for a fresh embryo transfer. So we would like to see a beautiful picture like this. So as you can see, this is a nice blastocyst. You've got a little clump of cells, which is called the inner cell mass, which is going to form the baby. You've got a surrounding single layer of cells called the trophoectoderm, which is going to form the placenta. And many times you might even see a hatching blastocyst, which is getting absolutely ready to implant. So embryo transfers in our clinic, one of the good things about our clinic is that we offer embryo transfers 7 days a week, maximizing your chances of pregnancy. You're given an opportunity to see your embryo on the screen, which does excite all of us. And you're also given a little picture of the embryo to take away. Embryo glue is an add-on our clinic offers to all the couples. It is a transfer medium which mimics the conditions in the uterus, and there are small studies supporting the fact that the use of embryo glue will enhance the implantation rates. What we also do on this day is, if you've got any spare embryos, so let's say a fresh embryo has gone in, but the couple has generated spare embryos. 1 in 4 couples may have spare embryos, and they've decided that they would like to do PGT. Then this is the day we also do embryo biopsy. And as you can see, this inner cell mass remains undisturbed. We don't want to do anything to the part which is going to form the baby, but we are able to aspirate some of the cells from the trophoectoderm, send it to our special genetics laboratory, and then we get some results back. Now, PGT again can be of 3 types. It's called PGT, which is the most common one. It stands for pre-implantation genetic testing for aneuploidy, and aneuploidy means abnormal chromosome numbers. So this is something we offer for deselecting aneuploid embryos, because we know that most of the embryos which either do not implant and consequently give us a negative pregnancy test, or they implant but result in miscarriages, are because of chromosomal abnormalities. So by doing PGTA, what we found is it is definitely decreasing the time to pregnancy and is significantly dropping the miscarriage risks. We've got other techniques as well. So PGTM is it screens for single gene disorders like cystic fibrosis, BRCA1, Huntington's disease. PGTSR is looking at structural rearrangements. So it screens for chromosomal rearrangement. So we do have these 2 techniques, are more time consuming, but something we definitely offer when required. And as I said, if a couple has got spare embryos and they want to freeze, without the PGTA, any embryos that we have not transferred will get frozen. And this includes embryos that were biopsied and all the embryos that people are not planning to take away with them. So that's those are sort of the steps which will happen on day 5. Okay, so embryo transfer is now done. The woman is now sent away with progesterone support, and 2 weeks down the line, we will be doing a pregnancy test. And what we then offer is if we find that it's a beautiful positive pregnancy test, we will organize the first pregnancy scan in our clinic as a part of the treatment package at 7 weeks. And what we would like to see is a beautiful pregnancy sac with a lovely yolk sac, a lovely fetal pole, and a nice good cardiac pulsation. We also offer a 10-week scan with an IPT, which is a non-invasive prenatal testing to look at Down syndrome and a couple of other chromosomal abnormalities. So that kind of brings me to the end of an IVF/ICSI/PICSI journey. In addition to these, we also have a few other treatment options, as I mentioned earlier. So we provide egg donation cycles, we provide sperm donation cycles. Egg donation is something a lot of women, couples will resort to either because the eggs have depleted due to age. Someone has gone through early menopause. Someone has, got the eggs have deteriorated because of chemotherapy. Some women may be born with poor egg quality and they've gone through a few cycles with no success. There are women who are born without ovaries, and egg donation becomes useful. And of course, surrogacy, where we may have same-sex male couples coming to us. They would like to use donor eggs. They would like to create embryos using the donor eggs with their sperms, create the embryos, and then transfer it into a surrogate womb and thus have a baby. Okay, so that's how egg donation helps. Sperm donation, again, similar circumstances. We could have individuals who need sperms because of lack of sperm production. The testis may have suffered because of chemotherapy, because of genetic disorders. We do have single ladies coming to us desirous of pregnancies using donor sperms, and we have same-sex female couples, again, utilizing donor sperms. Okay, so that brings me to surrogacy. Now, surrogacy is a procedure whereby we are borrowing someone's womb. Okay, so our clinic with more than 387 cycles, and I think these were statistics from between 2012 to April 2025. I think we are one of the leading clinics in the country offering surrogacy. We have a dedicated surrogacy team for intended parents and surrogates, many cycles. So as I mentioned, surrogacy is of 2 types, host surrogacy and straight surrogacy. Host surrogacy is the majority of our treatment cycles. This is where a womb is borrowed, or rather a woman is acting as a surrogate, and she decides she's got no genetic link. She's just lending her womb to carry a pregnancy for either a same-sex male couple or a heterosexual couple. Okay, so as I said, single people using own gametes can also use surrogates in certain circumstances. Sorry, I'm just going to make sure that I'm not missing. Yeah, so that brings me to the end of surrogacy. And if you need any more details, please feel free to contact our team. As I said, we've got a dedicated team looking after surrogates and intended parents. Okay, so apart from the self-funded cycles, we also provide NHS-funded fertility treatments. How do you access that? So we are in partnership with 3 ICBs, the Mid and South Essex, the North Central London, and the North East London. Your ICB is determined by the location of your GP and not where you live. So more information is needed, please visit our NHS webpage. So the NHS, so the North East London ICBs include Barking and Dagenham, Havering, Redbridge, Waltham Forest, City and Hackney, Tower Hamlets, and Newham. Mid and South Essex include the Mid Essex, Castle Point, Rochford, Basildon, Brentford, Thurrock, and Southend. And the North Central London include Barnet, Camden, Enfield, Haringey, and Islington. Okay, so I often get asked, what if we are struggling to fund this? Because we appreciate that, it's not, it's an expensive proposition. So there are other ways. So our clinic offers programs which include egg share scheme and sperm share scheme, whereby, let's say, for example, somebody is interested in sharing her eggs. She wants to undergo her own IVF treatment cycle. And if she qualifies due to age and her AMH, then she could potentially have her cycle, contribute, so divide the eggs between her and the egg bank and get the treatment at a really subsidized cost. So we do run this program. We also similarly run the sperm share scheme. So if any of you, sorry, is interested in this, please give us a shout or visit our website for further details. Okay, so thank you for staying with me. And as I promised, we have a January special offer. So if you are booking a new consultation by Friday, the 30th of January, a full price 275 consultation will cost you 137.5. It doesn't include the blood test and semen analysis, but that's the cost we are able to offer if you're able to book a consultation with us by 30th of Jan. Further fertility funding options, so we do liaise with Access Fertility and Assured Fertility, and there's more information available on our website if you are interested in packages. So kindly visit our website, or if you have a question, just put it in the chat. Wellness at Herts. So we know that this journey is an arduous journey. It is, it's a bit of a roller coaster. But what we feel is that you will never find yourself alone on this journey. Okay, even though I say this myself, you've got lovely consultants, a really good bunch of nurses, everyone who's so involved in this journey that, you know, when we see you for a pregnancy scan at the end of it, you can actually see the joy that all of us feel because we've made it to this point. So yes, you will find that there'll be a lot of emotional support offered to you. We've got dedicated counselors working alongside, and we've also got support via the website. So, you know, as I said, it's not going to be a lonely journey. So why us? We've got more than 36 years of experience. We've got 7 days a week laboratory service. We've got electronic witnessing system, which makes sure that there is no mixing. And, you know, you would have heard things in the press, which sometimes, you know, gives us cause for concern, but we've got electronic witnessing system just to make sure that nothing goes haywire. We've got more than 8,000 babies to our credit. You will find that you're supported throughout the treatment. There is emotional support for patients, and of course there is free parking. So that kind of brings me to the end of this presentation. I hope you have found this useful. I know sometimes it's very long, but I think it's good to have that information and have that a little overview. So sorry if I've kept you a bit longer after a long day at work. We do value your feedback, so please give us, you know, send in some feedback, positive, negative, anything. It helps us improve these presentations. Follow us on social media platforms mentioned here, and please don't go away. As I promised, I will now take you through the virtual tour of our clinic. So if you have to book an appointment, you've got our phone number, you can drop us an email at enquiries@hertsessex.com. New consultations are usually available within 4 weeks. Question answers, I'm sure you've been posting questions, and once this is over, I'll be joining Jackie. And please rest assured, we will be here till we've answered each and every question of yours. So once again, it's a very big thank you from me and my team, Jackie and Mana, and wish you all a very happy 2026. I'm going to stop sharing and I'm going to take you on a virtual tour of the clinic.